Flexible pads, known as intervertebral discs, provide a cushion between your vertebrae for the range of movements your head and neck make every day. The cervical spine supports the weight of your head, allows your head to rotate and tilt, and helps you bend your neck. Cervical disc pressure increases when your neck bends forward, backward, and sideways. Intervertebral discs consist of a tough outer ring of tissue called the annulus fibrosus and a soft jelly-like center called the nucleus pulposus. During a traumatic injury, your spine may be forced forward or hyperflexed, causing your vertebrae to compress the front of one or more of your cervical discs beyond normal limits. Hyperflexion of the neck is a common cause of cervical injury that occurs in motor vehicle accidents and some sports. As a result, your jelly-like nucleus pulposus is pushed backward into your annulus fibrosus, thinning your annulus and causing small tears. After a cervical disc injury, your annulus fibrosus begins to weaken and tear, and your nucleus pulposus becomes dry and stiff. Over time, these changes make your disc susceptible to further injury. As your intervertebral disc deteriorates, a weak annulus fibrosus can allow your nucleus pulposus to bulge, changing the disc's normal shape and flexibility. Depending on its size and location, the bulge may push on or impinge one of your spinal nerves or your spinal cord, causing pain and inflammation. Central disc bulges project backward into your spinal canal. Lateral disc bulges push into your neural foramen. Severe cervical disc injuries can tear open your annulus fibrosus. Pressure from your vertebrae may force the nucleus pulposus out of the torn annulus, causing a disc herniation. A herniated disc can impinge your spinal nerves or spinal cord, interrupt normal nerve signals, and cause symptoms such as pain, numbness, or weakness in one or both of your arms. Treatment for cervical
Intervertebral discs consist of a thick outer layer with a crisscrossing fibrous structure, annulus, that surrounds the soft, gel-like center, the nucleus. Discs function like shock-absorbing springs. The annulus pulls the vertebral bodies together against the elastic resistance of the gel-filled nucleus. When you bend, the nucleus acts like a ball bearing, allowing the vertebral bodies to roll over the incompressible gel. Each disc works in concert with two facet joints, forming a spinal motion segment. The biomechanical function of each pair of facet joints is to guide and limit the movement of the spinal motion segment. The surfaces of the joint are coated with cartilage that helps each joint move smoothly. Directly behind the discs, the ring-like vertebral bodies create a vertical tunnel called the spinal canal or neural canal. The spinal cord and spinal nerves pass through the spinal canal, which protects them from injury. The spinal cord is the major column of nerve tissue that is connected to the brain and serves as an information superhighway between the brain and the body. The nerves in your spinal cord branch off to form pairs of nerve roots that travel through the small openings between your vertebrae, intervertebral foramens. This is the condition of a normal lumbar intervertebral disc. As a disc degenerates and breaks down, the inner core can leak out through the outer portion of the disc. This condition is known as a disc herniation, which puts direct pressure on the nerve. Lumbar herniated disc symptoms include low back pain, legs and buttock pain, leg numbness, and tingling. As the disc degenerates and breaks down, the inner core can leak out through the outer portion of the disc. This condition is known as disc herniation, which puts direct pressure on the nerve. In consequence of aging or trauma, the intervertebral disc can be damaged or degenerated. Loss of disc height can cause bulging of the disc, putting pressure on the nerves exiting the spine. Disc degeneration and facet joints overloading can cause their arthritic overgrowth. This resultant loss of space in the foramen can cause squeezing or pinching of the nerve roots as they exit the spine. This condition is called lateral stenosis. Spondylolisthesis is a common lumbar spine problem when the disc is unstable and allows the upper vertebral body to slide forward.
Osteoarthritis is the most common form of arthritis and affects millions of individuals. It is classified as mild, moderate to severe. It affects many parts of the body, including the knee. The knee joint is made up of the femur, tibia, patella, along with the synovial membrane, which contains synovial fluid. Synovial fluid acts as a lubricant in the knee joint. The end of the femur is covered in articular cartilage, which moves against the articular cartilage of the tibia. In a healthy knee, the articular cartilage is smooth, without fissuring, and the bone is smooth. The synovial fluid is viscous, aiding in lubrication. The knee can move through its range of motion without pain. Over time, osteoarthritis affects the bone, cartilage, and synovial fluid of the knee. With mild knee osteoarthritis, you will begin to have discomfort in the knee joint. Though the joint space appears normal, the cartilage matrix has begun to break down from a combination of wear and tear and increased production of degrading enzymes. In addition, bone spurs, known as osteophytes, may begin to develop on the edge of the joint. These small, smooth, dense growths of bone are part of the body's natural response to the loss of cartilage. Progression of the disease may be slowed at this stage by increased exercise and weight loss. With moderate knee OA, changes in the joint are much more evident. The cartilage surface between the bones has begun to erode, narrowing the gap between the femur and the tibia. Hyaluronic acid, which helps synovial fluid lubricate the joint, is now becoming less viscous, elastic, and concentrated. Osteoarthritis often affects the subchondral bone, located just underneath the cartilage. Subchondral bone provides hydration and oxygen to the cartilage. As subchondral bone flattens and tries to repair itself, cytokines and proteins are released into the synovial fluid. Osteophytes may increase in number and size, making the bone rougher. All these factors combine to make joint pain more severe and long-lasting, both with movement and at rest. Weight loss and exercise, pain relievers, HA, or steroid injections are commonly prescribed treatments. With severe OA, conditions worsen dramatically. The joint space has become far narrower, causing more rapid and severe destruction of the cartilage. The knee becomes inflamed and sore. Synovial fluid is decreased, increasing friction and pain during movement. Within the synovial membrane, destructive proteins are produced which further degrade cartilage and soft tissue around the knee. Osteophytes continue to develop. Bone moves against bone, not cartilage. Mobility, activities of daily living, and quality of life are severely impacted. Treatment for severe OA is typically surgery by receiving a partial